Narval is the first CAD/CAM MRD solution on the market, bringing ResMed's innovation and excellence in sleep-disordered breathing to mandibular repositioning devices. Now that you have decided to offer your patient the unique Narval device, we would like to provide you more information about it. Using a high-tech CAD/CAM process, Narval provides a solution suited to the needs of your patient that meets your diagnostic requirements. Not all the patients can benefit from Narval CC treatment. Some medical conditions, like central sleep apnea or other severe respiratory disorders, loose dentition or untreated advanced periodontal condition, problems with TMJ, other dental conditions, patients younger than 18 years. It is important to advise your patient about their condition and to set the expectations that they have to wear their therapy anytime they are sleeping. It is also important to explain to the patient that dentists will monitor the patient's progress once the appliance is fitted and titrated. Using the impression material of your choice, which can be silicone or alginate, you should take an impression just as for any other dental procedure. Just as with any dental impression, you should check for impression of sulcus and full arch coverage. ResMed can accept additional diagnostic information you find necessary, including George gauge, bite registration in the desired protrusion, bite registration in central occlusion, or bite registration in maximum comfortable protrusion. It is necessary to define the desired protrusion, as this is where the treatment will start, and allow for optimal balance between patient comfort and efficacy. This will provide us with the information needed to provide you and your patient with a unique device that will suit their individual needs and meet your specific clinical expectations. Once the device is produced and delivered to you, you are ready for the device fitting. To explain to the patient how to use the device, moisten the device, put it in the right position, and help your patient fit the upper splint first. Now help the patient bring their lower jaw forward and help them fit the lower splint. While it takes some time to get accustomed to, the device will not prevent the patient from talking or sipping liquid with the appliance in place. It is common for patients to experience some initial symptoms of tooth discomfort and hypersalivation, which generally resolve in time. To remove the device, help your patient remove the lower splint by lifting the device away from the gum, proceeding in similar fashion in the upper jaw, and removing the device from the mouth. This is an opportunity to check the fit of individual splints and ask the patient about any painful spots or excess pressure on teeth. Finally, checking the biting contact for an even and balanced occlusion. Initial protrusion of the device is usually based on 50 to 60% of maximum comfortable protrusion. Once the patient is used to their Narval CC, you have to establish if their symptoms have improved. If symptoms persist, replace the connector in use with a 1 mm shorter connector, which is easily replaced. You will also contact a referring physician to provide them feedback on the therapy, so further diagnostic procedures can be organized. Regular 6 monthly checkups are needed, but your patient will now be able to fully benefit from Narval CC. Narval CC, brought to you by ResMed.